Welcome to another comprehensive video on stroke. In this video, we will discuss the definition of stroke, history of stroke, types, pathophysiology, causes, risk factors, symptoms, treatment, medication, epidemiology, and prevention of stroke. So let's begin. Definition of stroke. Stroke, also known as cerebrovascular accident, CVA, is a medical emergency that occurs when the blood supply to a part of the brain is interrupted or reduced, leading to the death of brain cells. The interruption of blood flow can be caused by a blockage in the blood vessels that supply the brain, ischemic stroke, or by the rupture of a blood vessel in the brain, hemorrhagic stroke. Stroke can cause various symptoms, such as weakness or numbness on one side of the body, difficulty speaking, vision problems, and severe headache. Stroke is a leading cause of disability and death worldwide and requires urgent medical attention to prevent long-term brain damage and improve outcomes. History of stroke. Stroke has been recognized as a medical condition for centuries, with descriptions dating back to ancient times. However, it wasn't until the 20th century that medical research began to unravel the complex mechanisms behind this condition. In the 1950s, the first treatments for stroke were developed, including anticoagulant medications to prevent blood clots. Types. There are two main types of stroke, ischemic and hemorrhagic. 1. Ischemic stroke. Ischemic stroke occurs when a blood clot blocks a blood vessel in the brain, reducing or cutting off blood flow to that area of the brain. This can cause brain cells to die and result in various symptoms such as weakness on one side of the body, difficulty speaking, and confusion. Ischemic stroke is the most common type of stroke, accounting for approximately 85% of all strokes. 2. Hemorrhagic stroke. Hemorrhagic stroke occurs when a blood vessel in the brain ruptures, causing bleeding in the brain. This can lead to brain damage and symptoms such as a severe headache, vomiting, and loss of consciousness. Hemorrhagic stroke is less common than ischemic stroke, accounting for approximately 15% of all strokes. There are two types of hemorrhagic stroke, intracerebral hemorrhage and subarachnoid hemorrhage. Intracerebral hemorrhage occurs when a blood vessel within the brain ruptures and bleeds into the brain tissue. Subarachnoid hemorrhage occurs when there is bleeding in the space between the brain and the tissue that covers the brain. Pathophysiology. The pathophysiology of stroke is complex and involves multiple mechanisms. In ischemic stroke, a blood clot blocks blood flow to the brain, leading to brain cell death. In hemorrhagic stroke, bleeding in the brain can cause damage to brain cells and increase pressure on the brain. Causes and risk factors. The causes and risk factors for stroke include high blood pressure, smoking, high cholesterol, diabetes, obesity, family history of stroke, and advanced age. Other factors such as atrial fibrillation, a heart condition that causes an irregular heartbeat, and carotid artery disease, a condition that causes narrowing of the arteries that supply blood to the brain, also increase the risk of stroke. Symptoms. The symptoms of stroke can vary depending on the type and location of the stroke. Common symptoms include sudden weakness or numbness on one side of the body, difficulty speaking or understanding speech, loss of vision, sudden and severe headache, and difficulty walking or maintaining balance. Treatment and medication. The treatment and medication for stroke depend on the type of stroke and the underlying cause. In ischemic stroke, treatments such as tissue plasminogen activator, TPA, and mechanical thrombectomy may be used to dissolve the clot and restore blood flow to the brain. In hemorrhagic stroke, surgery or medication may be used to stop bleeding and reduce pressure on the brain. Epidemiology. Stroke is a significant public health problem and a leading cause of death and disability worldwide. According to the World Health Organization, stroke is responsible for 11% of all deaths globally, with over 6 million deaths each year. In the United States, stroke is the fifth leading cause of death and a leading cause of long-term disability. Prevention. Preventing stroke involves managing risk factors such as high blood pressure, smoking, and diabetes, as well as maintaining a healthy lifestyle with regular exercise and a balanced diet. Medications such as anticoagulants and antiplatelet drugs may also be used to prevent blood clots and reduce the risk of stroke. In conclusion, stroke is a medical emergency that can have serious consequences. Early recognition of symptoms and prompt treatment are essential for a good outcome. Understanding the causes, risk factors, and prevention strategies for stroke can help reduce the incidence and impact of this condition. Thanks for